ADHD, it's one of the most common mental or neurobehavioral conditions in children. The diagnosis can be scary for parents and the kids.
But a Vanderbilt pediatrician wants families to know it's treatable and kids can thrive. We continue our special reports on kids and mental health.
Most children are active, energetic, and can easily get distracted. But what behaviors raise the red flag for possible attention deficit hyperactivity disorder, or ADHD?
Rushed work, poor work, not paying attention in class, being easily distracted, the hyperactivity symptoms, they might be very fidgety or wanting to pace the room or always be moving. Sometimes they can have impaired relationships with their peers, like they don't always understand social cues.
Dr. Rosemary Hunter is an associate professor of pediatrics at Vanderbilt. She says teachers are often the first to notice the behavior and alert a child's parents. Doctors use a tool such as the Vanderbilt ADHD Diagnostic Rating Scale to make a diagnosis in children ages 6 to 12. There is a parent and a teacher questionnaire.
Those forms also screen for mood disorders, so depression or anxiety, or significant oppositional behaviors.
Dr. Hunter says ADHD is a common diagnosis in childhood.
When you look at CDC data, about 8% of the children in the U.S. are diagnosed with ADHD.
The first step in managing ADHD is behavior modification. That often includes breaking down school assignments into smaller segments and taking frequent breaks, even allowing fidget toys or freedom to move around in the classroom. The same goes for tasks at home.
Let's say for homework, that you would have a lot of active play in between time to help them run off some energy. You would break down chores or tasks into small things. You might have visual cues, like on a chore chart.
If those tactics aren't enough, doctors may prescribe medication, often a stimulant.
Either we want the child to still be who they are and have their personality shine through. So we'd want to be careful about which medications we chose and how much we use. One of the nice things about stimulants are they're sort of pretty quickly metabolized in the body and excreted. So even if you try a medication for a short period of time and you, let's say, don't like it or some of the side effects, you can always come off.
Most importantly, Dr. Hunter says families should not look at an ADHD diagnosis as a label or a detriment.
You don't want them to think of themselves as, I have this disorder and I have a problem in school and I'm going to struggle. We want areas of their life where they are successful and they succeed at, because there are a lot of very famous people with ADD who have succeeded very well.
Now, ADHD often affects people into adulthood, so it's something that may need to be managed with the help of a physician throughout life. There are many online resources available for families. Just look for this story on our website under the Special Reports section.